Science is about pushing boundaries and pushing frontiers. I think there isn't a magic ingredient other than carrying on. Resilience is important. I wasn't planning to be a scientist. I went to Zimbabwe 22 years ago to essentially work in the hospital. And so I had patients who were age 12, 13, 14 coming to the adult wards that had AIDS, were not diagnosed. The understanding at the time was that children born with HIV in the pre-treatment era would be dead by the age of 2. So why was I seeing 12-year-olds with HIV if the vast majority of them had died in early childhood? And really that was the question that drew me to science. I led a series of studies through my doctoral research which showed that at least a third of infants born with HIV would survive to adolescence even without treatment. These children were surviving, but they had lots of illnesses. There was often judgment. So there was a nuance to it, a whole socio-cultural context that accompanied the HIV epidemic that was occurring in children. And I felt that unpicking that could potentially change the trajectory of the way care could be delivered. So we developed a number of age-appropriate strategies to identify and test adolescents with HIV, and also strategies to facilitate linking them to care models that were appropriate to the age group and addressed not just their clinical needs, but also their psychosocial needs. It's important to be thinking about their schooling, their education achievements, their mental health, their sexual relationships. Now, it is a completely changed landscape from 20 years ago. Of course, antiretroviral therapy drugs came along during this period, but they're not the only thing that came along. There is recognition that adolescents have very special needs. We're training a new generation of scientists and teams of people that are going to be working as support workers in communities or clinicians. Giving treatment and keeping children and adolescents alive is not our end game. It's ensuring that they have optimal lifespan and the best quality of life that they can have. And that's what we're working on.